911 in KwaZulu-Natal has become the first emergency medical service in South Africa to receive a gold award at the International Angels Awards, meaning it meets international standards in the treatment of strokes. The strokes are the second leading cause of death worldwide. Paulse filed this insert.
An accolade in pre-hospital care, improving survival rates and quality of life outcomes. The Emergency Medical Services team has been recognized for its quick turnaround in treating stroke patients. A stroke is a medical emergency that occurs when blood flow is either cut off or is reduced, depriving the brain of blood and oxygen.
One of the common sayings you'll hear is time is brain. The sooner we can get a patient to a stroke-ready facility, the more possibility we have of saving brain, of the patient having a better prognosis. So the golden hour is still applicable in a medical emergency.
The team has also been lauded for its innovative means in assisting patients in rural areas over video calls.
We can activate additional resources such as our aeromedical division, and we can send our helicopter for more rural or longer distance cases as well to provide further intervention.
Neurologist Dr. Patty Francis says the most common strokes that occur is the acute ischemic stroke, with the primary risk factor being high blood pressure. But there is a notable increase of hemorrhagic strokes in sub-Saharan Africa, which is the bleeding into the brain by the rupture of a blood vessel.
In the sub-Saharan African context, there are more hemorrhagic strokes than globally, so that percentage of 15% globally is higher in the sub-Saharan context because of a more virulent type of hypertension in the sub-Saharan context.
She says there is also a misconception that the younger generation cannot suffer strokes.
We do see a significant proportion of the strokes that are treated at our hospital are patients in their 40s. We have seen patients in their 30s, and we have actually seen that even younger age group of young female patients, the youngest of which I can remember offhand was 16, and my second youngest was 18, where they developed strokes shortly after going onto the oral contraceptive pill, because that is another risk factor in a specific subset of patients. But the hypertension story is accurate. Hypertension is the leading cause of stroke worldwide. It is always dubbed a silent killer because it's asymptomatic.
Globally, an average of 1 in 4 adults will have a stroke during their lifetime. For SABC News, I'm Paulse in Durban.
For more on this, we're now joined by Mande Toubkin, Netcare's General Manager for Emergency Trauma and CSI, for more on this discussion. And she joins us via our video link. Mande, thank you so much for joining us here on SABC News this evening. Of course, we've seen that Netcare 911 has been awarded with the Gold Award, which is the first ever for South Africa. Clearly, there's something here that you are getting right in your unit.
Thank you very much for the time. Yes, I think the most important thing is that in South Africa, we often do things without having data available. And by putting our data into an international database, we're able to actually not suck the results out of our thumb, but rather say, these are our actual results and this is what we can do to improve it. And so working with our emergency services, Netcare 911, we've been loading the data to see how we're actually doing. And we're proud to say that KZN has been the first to actually show that the work that they've put into getting stroke patients to hospital, the right patient to the right hospital at the right time, is certainly making a difference. So yeah, we're very proud of them. Not far behind are our other services in other provinces.
And of course, this is something very important that you are indeed getting right, and that's to prevent further damage caused by strokes. If maybe you can explain to us how important is it for you and your team to actually prioritize how you respond to strokes?
It's extremely important. Stroke is a time makes a difference in stroke management and recovery from stroke. Some people will do exceptionally well and others won't do well at all. But the best probable thing that we can do for people is to make sure that we get them within a timeous service, into a timeous service that really prioritizes their care. So you can't be a stroke patient lying in a waiting room somewhere to be seen, and you shouldn't be going directly with a stroke to the GP and then 4 hours later arrive at a hospital. Your outcome is really dependent on the time that you get to hospital and the things that we put in place to prevent that stroke from getting worse, to actually recognize it and to actually aid you in your recovery. But it doesn't only start there. I mean, it starts in the pre-hospital environment with people recognizing stroke. And we're also teaching children now through the Angels Initiative, young children, to recognize stroke in their parents and their grandparents so that they can phone for help. So a lot of it is dependent on education, and then once you know what's going on, getting you to the right hospital to make sure that you get the care you need.
And, one would say that capacity is always a question that comes into play here when it comes to how your paramedics are capacitated in dealing in terms of how they respond to strokes as compared to state hospitals or state emergency service personnel. How capacitated is the Netcare 911 team to actually respond immediately when they receive calls, especially calls about strokes?
I think most emergency services are capacitated. The difference is how far you are from the nearest ambulance. And so the important thing here is that that coordination of services to get the closest vehicle to you possible. I think that 911 is exceptionally well capacitated, but I can tell you that there's some towns in the country that we don't have ambulances. What we then have is cooperating services that we work with that we can dispatch another service. So the ultimate issue is that in areas where teams aren't available, that people create networks. And care is about network, whether it be private or public. It's not about anything. More important is the patient in the center of all of this. And networks are extremely important. And I can tell you that there are some state hospitals that are doing exceptionally well with stroke management. I know Charlotte Maxeke is doing well. I know Pretoria Academic is doing really well. And there are many others that are doing exceptionally well and lead the way as well. And so I think that it's time that we all put our resources together and we make sure that anyone who suffers a stroke gets the best possible care.
Of course.
The problem is if you're out in a rural area and you have a stroke, your time to get to definitive care may be the deciding factor.
And I wanted to come to how actually you've been dealing with the response and, making use of the different networks you have. And, looking at my colleague's story there, and she talks about how you've even prioritized, doing video calls to try and reach those, especially in rural communities. How did this come about? Trying, instead of getting to the patient first, you are already utilizing technology to try and treat the patient before even the paramedics get there.
Yeah, look, I think in South Africa, we're so blessed to have emergency medical services that are so well trained. And if we're able to communicate with somebody in the periphery, in the rural area, and say, look, it looks like you are having a stroke and these are what the symptoms are, we know that they can start prioritize getting themselves to the hospital and we can meet them halfway, or an ambulance can meet them halfway. So it's always difficult in any country. This is not a South African issue. Any country in the world has centers that are close to hospitals and centers that are far from hospitals. What we've got to do is we've got to make sure that patients know that they recognize it. And many people at home don't recognize stroke. Many people wake up with stroke. You heard the doctor talking about hypertension, high blood pressure. We've got such an epidemic of high blood pressure in the country, and that is the cause of the majority of the cause of strokes within South Africans. So managing high blood pressure before you have a stroke is actually more important than managing the stroke. So making sure people get to clinics, making sure that people get the right medication for their blood pressure, changing their diet, stress levels, other factors such as you heard about using the pill in young people, or many other factors that may cause stroke. So I think making sure that we look at it before the stroke happens. Prevention is always better than trying to fix the problem after it happens.
Yeah.
And I think this is what's important in teaching children with the Stroke Heroes. I don't know if you know about the Stroke Heroes program, where the clot is the ugly clot, and we're teaching children to recognize when granny starts to talk to you funny, there's something going on. Don't just allow it to continue. Make sure that she gets to help, or grandpa gets to help, or mom or dad gets to help. So if you start with everybody recognizing it, and you start even before that with trying to fix what makes a stroke, I think we'll do a lot for South Africa by making sure that and it's the same with other things like heart attack.
Yeah.
It's the same with many of the diseases that we are faced with. If we can put things in place beforehand to prevent them, and then if they do happen, things in place that manage them, South Africa will have an amazing healthcare system to look forward to.
And Mande, I know that you have been teaching children in terms of how to recognize strokes. Perhaps if you can just give a bit of advice to South Africans who may not know what the symptoms of a stroke may look like, and what they should do immediately when they notice such symptoms with their loved ones.
Yeah, I think it's very, very, very simple. I mean, we're looking at something called be fast. So in any case, when you notice something happening, you have to be fast about how you respond to that actually happening. And so what we're saying is time is brain, okay? And so we want you to be fast. You need to be stroke aware. So get yourself educated. Balance becomes difficult. So someone who's battling with balance, their eyesight may change, as in the BE. The face may droop on one side, so you might see a droop. And there's arm weakness. So if you ask them to lift their arms, the one arm will droop. And then, speech may be affected, and then time to get to help. Very, very easy symptoms. You will notice anyone who's talking to you and then all of a sudden becomes confused and doesn't know what they're saying and can't lift their arms and is drooling. You know straight away something is wrong.
Yeah.
Then you need to say, hang on, I've heard about this before. Let me get some help for my loved one.
Thank you so much, Mande, for that advice. That is Mande Toubkin. She is Netcare's General Manager for Emergency and Trauma and CSI, just giving us a bit of advice there when it comes to how to deal with strokes. So should you notice any of these symptoms from your loved one.